Alright, thank you guys for watching another video. This video is going to be sports massage. We're going to be working the quadriceps and the medial side of the leg as well as the lateral side of the leg. And when we flip our client over in the prone position, we're going to go over the hamstrings in the prone position as well. So these are the common muscles that start off, running, wrestling, swimming. These are your power muscles on the front. These are the ones that get fatigued more than others, except for the calves, which we'll do next time. But we're going to go over the quads. So how we warm up the quads, we're going to use our cream. Now, if this is pre-event, before the event even starts, we do not use cream, only a little bit, a tad bit, just about that much. So this is after the event. We're going to calm our athlete's legs down. Or if you're in the mood or your athlete, they do have time for a massage during the Olympics or whatever it is, you can use full cream, like everything, just how I just had it in my hand. So you're just applying your cream or your lotion or whatever you're going to use to slip and glide, coconut oil, whatever people use these days. And all I'm doing is slow strokes. And then after the leg is warmed up, I move into faster strokes. And I'm pumping that blood, moving the blood towards the heart, towards the body. Right, she's nice and warmed up. So now I want to work the top of the quads. So working the top of the quads, I like to strip the quads. So stripping, we're not here to give somebody a full-on, petrissage, effleurage type of massage. I want to strip into these muscles. I start at the kneecap, right down here. And I'm going to show you a closer view in just a minute. So both thumbs like little birds flying away, or bat. Right at the top of the kneecap, at the top of the patella tendon or bone. You're pushing in and you're moving slowly. As the skin will start to ripple, don't worry about this. It will move underneath your thumbs like such. And you're just moving slow. A little painful for the athlete, but it feels great afterwards. Now this thumb, my right hand thumb, stops here. This hand keeps on going. Because if you keep on going with your right hand, it could be a little bit suggestive, so be careful. Same thing, start at the lower point of the lower ligament for the quads, which is connecting to your patella tendon or patella. Move on up with both thumbs. So now that you did 2 passes, now I want to work the medial side of the legs, but let's go ahead and try to do something deeper. If somebody doesn't want thumbs, if they want deeper pressure, what do? You can do double palms if you want to, pressing down. So I'm in my nice archer stance, like I'm about to pull a bow and arrow or whatever, little archer stance. Hands come together, like about to throw a fireball or something. And then press into the legs. And my body weight is forward. So if that's not hard enough, you're going to have to use your elbows. So elbows, grab a little bit of cream, just a little bit. Palm, get those forearms. And elbow. We don't want any greasy elbows or ashy. So when I'm starting in, I'm always crossing over the kneecap into my position. So again, that's over. And then glide down. If they want more pressure, when you're gliding down, hand goes on top of your hand, and then you really, really lean in. And you check with your client, how was that? That wasn't too bad?
Good.
Perfect. Nice and slow. So let's go over those moves again at a closer view so you can see what I'm talking about. Okay, here we are at a closer view. Remember, in the beginning, all we did was start with a little bit of cream, palm of the hand, rub it together, apply your cream or your lotion or your coconut oil, jojoba oil, whatever people are using these days. Just be careful. It might not be what the athlete wants. Just use regular plain cream lotion or cream. With no additives, don't have anything smelling, aromatherapy, it might have an allergic reaction to the athlete. So now that the leg is nice and lubricated up, how's the thumb stripping? Remember both of those thumbs like a little bird or a bat? Right here at the kneecap. Your patella is here, patella tendon is here. So remember the tendon attaches to the bone, which is the patella bone. So not on the bone, do not put your fingers here. Go right where the tendon is, where it dips down. Then see how the knee buckles? Don't worry about that. It's going to go underneath your thumbs. Just go slow. You do not go fast. And see how the skin finally loosens up and goes underneath your thumbs. And you start to really feel her tendons and the muscle underneath your thumbs if you press that hard. So let's strip again. See how red my thumbs are? See the white and then the redness? That means I'm using pressure. So see how it goes back to normal? I press in. You see the white tips on my thumbs. Because I'm using pressure, pushing out the blood of my fingernails. So remember, we're not doing petrissage or fluff and buff and all that other good stuff. So remember, we're doing our palm press, like you're throwing that fireball or whatever you're doing. Palms together, both sides of the legs, and you push forward. Again, both sides. Watch those fingers to the right hand, lift them up, move forward. You can even shake up top because the hips get funky right in here, this junction. Remember, you have your AS, IS, or the AIIS as well. So your inferior iliac spine, then your anterior superior iliac spine, ASIS and AIIS, and it all attaches right here. AIIS, ASIS. For those massage students in school, you're going to pass your test. So after the fireball move, whatever you're going to call it, moving in with both your palms, use your elbows because you want deeper pressure. So your elbows, you're crossing in and you're adding that weight, your weight, onto them. So deeper pressure, same thing. This hand comes on top of this hand and you really lean in. Now you can do a super deep tissue move to where your hand is up this way, clasping together and really digging in there, but you're going to injure your athlete. If they're injured and their muscles get ripped, they can't perform. You've cost them a contract, you've cost them millions, sponsorships, all that good stuff, a free scholarship, whatever it is. You've messed up the career of that student or athlete. You don't want to do anything too hard, okay? So now we're going to work the inner thigh. So for the inner thigh, we're just going to cradle our client to the side, just like a figure 4. If they're happy here, you leave them here. But if they needed support for their legs, you come underneath their ankle, lift the leg up, your leg comes underneath theirs, or your kneecap, and then place it on top. For those athletes who can't go that far in a butterfly motion. But she can, so let's just keep it at this point right now, and then we'll go into the flatter side to where she doesn't need my support. So lotion or cream. And all you're doing is gliding, introducing the cream to the body. So again, remember those thumb strips right in here, but not too hard because it is sensitive. This whole leg and the inside of the leg is very sensitive. So just take your time. Nice and slow. And so when you're working on that sartorius, the gracilis muscle, abductor magnus, which is that wing muscle that goes on your femur and actually attaches to two parts of your leg. I'm just having a hard time figuring out the other part, but it's a wing-shaped muscle, gracilis or abductor magnus. It comes down, and it's almost like a latissimus dorsi muscle for your legs. Like the lats on your back, same thing in your legs. Comes on down, and it hooks back on in. So it's a wing-shaped muscle that allows adduction, to squeeze. Like if you had somebody, UFC fighters or whatever, you have somebody's head in between your legs, and you squeeze. Is those adductor muscles, pectineus, adductor magnus, sartorius, gracilis. And there's one I'm forgetting, but it's alright. So after we just did our stripping, nice and slow, both hands, or you can alternate both thumbs, whatever you want to do. So they want deeper pressure, forearms. You can do your double palms if you want to. I'm pretty sure you already know how to do that, so let's move on into something harder. So you're just rocking in with your elbow. And it's kind of harder to get to this position because her kneecap is going to hit my chest or stomach. So that's why when we go to the next position, I'll show you how easier it is if the client's leg is fully down on the table. So again, forearm. And ask your client, how does that feel? Is it okay, Riley? Okay, good. So say your client can put their leg all the way down in the figure 4 position. Their hips aren't getting in the way, everything is flat. So, forearm, now you can really, really lean without anything hitting you because you're on top of the leg. If that's too much, palms. So you're just palm pressing. And you'll actually start to feel the muscles as long as you go slow and deep, you feel the muscles. But if you go fast, you really don't feel anything but skin. So the slower you go, even underneath my forearms right now, I can feel our muscles, especially the inguinal ligament. I always had a problem pronouncing that, but it's right here. It's the tightest, or as well as your sartorius is right here. Because remember that sartorius comes down, crosses over, and hooks into that kneecap. So that's the middle of the leg. Say you want to work on the middle leg, they want a deeper stretch. So off the table, or move them up a little bit further, foot is going to come right into your hip. So all you're going to do is grab her leg, put it right into your hip, switch your position. This leg should be forward. So I'm leaning forward because it's going to be your lean leg. You can switch and go this way if you want to, but me, I like to be next to the table so I don't fall or anything. So now she's really, really hyperextended, and you can really work the hamstrings as well on the back side. With fist, thumbs. And then from here, the medial side of your calves, you work as well. So both thumbs, you're going to thumb strip again, same move. All the way up. The back of the calf, work those calves. And it's the frog woman position. So welcome back. So now we're going to grab some more cream. Our client is now in the prone position. So the prone position, we're going to work our hamstrings Lower legs, remember, we're going to work that in the next time. So you get a little bit of cream. Actually, it's a little bit too much. So if you have too much, just scrape out a little bit, put it back into your container. You should be fine. We didn't use it yet. New hands, new legs, we're doing great. Back the hamstrings, warm them up. Warming up the leg, that's all we're doing. So remember, the hamstrings, same thing. We have semi-tendinosis, semi-membranosis. Then you have your biceps femoris back here as well. So those three major parts of the hamstrings, we're gonna thumb strip. Remember, both thumbs right on the sides. I always start in the lateral side or medial side of the leg first. You can start lateral or medial, doesn't matter. And you'll feel little bumpy grooves in between the muscle. Those adhesions, you want to pop those. You want to feel them popping underneath your thumbs, which they are. And then ask your client, how does that feel? Was that too much?
No, it's good.
Perfect. So from here, I just did the medial. Now I just move over a little bit and start in the middle. Be careful of the popliteus in this area right here. Your plantaris muscle, the popliteus muscle. Don't start in here. This would hurt. You can massage this nice and light, don't get me wrong, but start a little bit further down. And see how she tensed up a little bit? Yes, it gets intense in the middle. But they need this. Athletes need it. Not even athletes, anybody who's active workers. Your girl comes home, you know, work those hamstrings. She'll love you for it. And then, lastly, the lateral side. So I worked here, here, and now I'm going to work here. Just thumb stripping. Right on up to where they originate. They originate right back here at the ischial tuberosity. So the ischial tuberosity is right where your gluteal fold is, right where most clothing folds or your butt folds, that little lip area. That's where they attach. They insert down here, medial side, lateral side of the tibia and fibula, and a little bit of kneecap. So, thumb stripping wasn't enough. Both of your palms, same thing. You can do circles if you want with both of those palms. Everything's nice and slow and controlled. If that's not enough, you're going to switch to that forearm. Remember the same move. Come across, move down, or up towards the client's body. More pressure, hand, left hand goes right on top of the right, and then you lean in. Your whole body weight should be leaning towards her. And then back off the leg. So that's how I work the hamstrings for the athlete, either during or definitely after their event, because I want to bring their muscles back together. I want to strip out all that lactic acid or built up toxins, anything that's hindering them, scar tissue, adhesions, anything that may hinder the athlete from a full recovery. Their recovery time is going to be much, much quicker, especially if you put ice, do contrast treatment first. Some ice first for about 5 to 8 minutes. Freeze these muscles up. They're not going to like it, or if they can take an ice bath, that's even better. So after the ice bath, heat these muscles up with either hot stones, a hot pack, whatever you can do, some rice in a bag, put it in the microwave, it does the same thing. Then you massage the legs. Their recovery time will be cut in half, guaranteed. So that's how I work these hamstrings. Hamstrings are attached to what? The glutes. So when you're working on the glutes, it's kind of the same movements, but she has clothing on. So clothing, that's fine. You're just pretty much doing your palm press or knuckle press right now. Then you do your palm press. Work on in with the palms. It's almost like you're doing that 100 hand slap like E Honda in Street Fighter was, you know, his hands are doing something crazy. But you're pretty much doing it on the client's body. You get low, you get the side muscles and the side glutes, because those glutes, gluteus maximus, gluteus minimus, gluteus medius, is all on the, or medius and minimus are on the side. Maximus is back here. So you need to get those side glutes, open that athlete up, get their hips out of that funky position. And that attaches right into the IT band as well. All the way to the other side. And these are just palm presses. I'm pressing on down, or you can press on up. I'm holding with other finger here or other hand. My palm goes here, and I'm just rocking in, move, in, move, in, move again. So when I say move, you're moving just slightly. Move, slightly. Move, slightly. That's all I'm doing when I'm circling. Do it about 3 times. 1, 2, 3, move. 1, 2, 3, move. 1, 2, 3, move. It's like when you're doing push-ups or some military cadence, whatever you're gonna do. It's always after repetition, and you move on to the next muscle. And you'll never really get out of sync that way. If you're rubbing your butt for more than 10 times in the same area, your client's like, okay, what the hell are they doing? Is he just getting his feels, or she getting her feels? Move on, you know what I mean? Shake up the body, move your... Because people, trust me, they judge you. And other people are looking as well. Sometimes you can have people who have parents there, boyfriend there, husband, wife. They're all eyeing you. So now, for an extra tidbit, I know a lot of people have been asking, how do I get the glutes if nobody wants me to work on top here, if I don't have enough strength, and I feel that I'm not stretching out the glutes as much as possible, as much as I can for that athlete. Because some athletes are huge, they're big, their butt muscles are just as big as your body. And you're gonna meet some of those. So her, she's nice and petite, she's perfect. But if it's a bigger client, or nice, small, petite, in shape client, such as her, you're gonna do the same movements. All you're going to do, you're gonna lift up the leg. You don't have to lift it up this far if you don't want to, but you're just pretty much stretching them out, letting them know that, hey, I'm about to do something, because this is going to be a stretch on the front side of the quad as well. So now that you know that they're flexible, come back up to about 90 degrees. 90 degrees, this hand is going to slide underneath this kneecap, or this side of the leg onto this side of the kneecap. So lift up, slides underneath. And when I lift it up, only lift it just a little bit. I'm not lifting the leg all the way up here. You don't have to. You're just lifting up a little bit, sliding in real fast. So put your hand here, slide underneath. Again, slide underneath. So you're lifting and sliding at the same damn time. So now this hand on this side is going to pull this leg to the side. That's all you do. So from here, grab a little bit of cream. Her leg is perfect. Not everybody's leg is going to fall like this. Some people's legs are going to fall off the table. But she's in damn near perfect shape. So her ligaments and muscles, they stay where they're supposed to be. Nice and lubricated. Get the lower leg to the foot. So from here, you're doing the same exact moves. Again, double thumbs, getting that IT band. Double thumbs. When your thumbs are together, it's more power. If they're separated, you're using 2 different muscles at the same time. When you're using both of these adductor pollex muscles together, it's more pressure and less work for you. Remember, palms. And then again, forearm. Be careful of the forearm. If the forearm is in contact with the IT band a little bit too long, it hurts. Your IT band is only so super thin. It's not a whole connected muscle, it's connective tissue. Connective tissue, it comes into a muscle up here for your pectineus, your gluteus minimus and medius come into the IT band as well. So from here onto the kneecap, it's all connective tissue. So use light pressure. If they want hard, deeper pressure, give it to them, but not too much. Just be careful. Nice, slow, and controlled movements. Now, if she didn't have any clothes on, your client feels comfortable, you're going to take that glide all the way up, all the way back down. Everything. Even to your QL muscle, your quadratus lumborum, and all your rectus spinae group muscles back here, lower back. The thoracolumbar fascia, that's so thick and connective tissue that pounces on or pounds on the lower back. You need to bring it all the way through. So, in this position, if they need a more stretch than what is, take the leg, hand goes underneath the kneecap. This hand, scoop it underneath. Lift the leg up a little bit to go forward. This foot goes into your hip. So if the foot's in the hip, you can move forward if you want to. And that's a deeper stretch, forearm, palms, whatever you want to do. Thumb stripping you can't really do from this angle. So I just take both of my double thumbs and just squeeze and get those hamstrings. And that whole client's body should be rocking. If they're rocking, that means you're doing work. They're going to remember you because they're going to go to somebody else eventually if they're out of town and they really need a massage, and they're not going to be pleased. They're like, man, you do more than what those other people do. So remember, sorry about that. So now continuing on, palms, circles. Remember, 1, 2, 3, move. 1, 2, 3, move again. Move again. Just remember that cadence in your head, and you'll do fine. You do palms, both of them at the same time. Forearm. So I can't see what's on the screen because it lost its connection. Crazy. Double thumbs down the extensor side of the legs. Forward palm. And then you bring the leg back to neutral. And that is it. Thank you, Riley. You're wonderful. You survived. Again, thanks so much.